colon cancer is striking younger adults, and it's more aggressive than ever. What was once considered a disease of older age is now showing up in people under 50 at a staggering rate. Colon cancer is no longer confined to seniors. In recent decades, a sharp increase in colorectal cancer diagnoses among younger adults has left the medical world deeply concerned and urgently searching for answers. And here's what makes this shift even more frightening. Colon cancer is one of the most lethal cancers, precisely because it's so quiet in its early stages. It often develops without any obvious signs. That means by the time symptoms do appear, the cancer has frequently advanced, making it much harder to treat and reducing the chances of survival. So, what's behind this alarming trend? Why are more young people being affected? What are the subtle signs that most people miss? And most importantly, how can you recognize them early enough to make a difference? At Healthy Care, we believe that awareness can save lives. That's why in today's video, we're diving deep into the 10 silent symptoms of colon cancer that you should never ignore. These are the quiet signals your body may be using to alert you, long before the disease makes its presence known. We'll also unpack the startling rise in cases among younger adults and explore the potential causes behind this disturbing spike, from lifestyle shifts to environmental exposures. Colon cancer doesn't wait, and it rarely gives second chances. Early detection is the most powerful weapon you have. So if you're serious about protecting your health and the well-being of those you care about, this is the information you can't afford to miss. Let's begin. 1. Unexplained nausea or vomiting. Everyone experiences nausea from time to time. Maybe it's food poisoning, a stomach bug, or even stress. But when nausea lingers without explanation, it could be a sign of something much more serious, like colon cancer. Unlike occasional queasiness, persistent nausea, especially when accompanied by vomiting, can indicate a growing tumor is disrupting normal digestion. As a tumor enlarges, it can partially or completely block the passage of food through the intestines, leading to a buildup of pressure that triggers nausea. Research from the World Journal of Gastrointestinal Oncology has shown that patients with colorectal cancer presenting with nausea and vomiting often have advanced stage disease due to intestinal obstruction. This is because a blocked colon prevents waste from moving properly, causing food to back up and leading to severe discomfort. If nausea comes with bloating, abdominal pain, or unexplained weight loss, it's time to take a closer look. While stomach issues are common, persistent nausea without a clear cause isn't something to brush off. It's your body's way of saying something isn't right. 2. Anemia. Most people dismiss anemia as nothing more than feeling a little tired. But when that fatigue seems to appear out of nowhere, it could actually be a red flag for something far more serious, like colon cancer. Anemia happens when your body doesn't have enough red blood cells to carry oxygen efficiently, and that leads to symptoms like constant fatigue, lightheadedness, and overall weakness. But here's where things get more concerning. In cases of colon cancer, anemia isn't typically caused by a lack of iron in your diet or a simple vitamin deficiency. Instead, it stems from something you can't see: internal bleeding. As tumors slowly form and grow inside the colon, they can cause tiny, continuous blood loss over time. And because this bleeding is often microscopic, it doesn't always show up in your stool. Yet, day by day, it quietly drains your iron levels, leaving you feeling worn out no matter how much you rest. In fact, research published in the Journal of Gastrointestinal Oncology revealed a striking detail. 1 out of every 3 people diagnosed with colon cancer had anemia as one of their first warning signs, even before they experienced any digestive issues. So, if your blood tests come back showing low iron for no clear reason, or you find yourself constantly running on empty despite a good night's sleep, it may be more than just everyday exhaustion. Anemia can be the body's subtle way of sending a signal, whispering that something dangerous might be going on beneath the surface. And listening to that whisper could make all the difference before it becomes a roar. 3. That not quite done feeling. You've finished in the bathroom, but something doesn't feel right, like there's still more left, even when nothing comes out. This uncomfortable, persistent urge isn't just an annoyance, it could be a sign that a tumor is interfering with your colon's normal function. As a mass grows inside the large intestine, it can create a blockage that makes it difficult for waste to pass smoothly, leaving you with a sensation of incomplete emptying. Many people mistake this for constipation or hemorrhoids, but the key difference is persistence. If this feeling lingers for weeks, it's not just a random digestive issue, it could be an early symptom of colorectal cancer. Research in the British Journal of Cancer found that patients who reported ongoing incomplete bowel emptying had a significantly higher likelihood of developing colorectal tumors. The problem? This symptom is often subtle at first, leading many to ignore it. But if you find yourself making multiple trips to the bathroom without relief, it's time to listen to your gut, literally. The feeling of unfinished business might be your colon's way of sounding the alarm. 4. Blood in your stool. Not all blood in the stool is the same, and that's what makes this symptom so deceptive. If you notice bright red streaks on toilet paper or in the bowl, it may be coming from the lower digestive tract, often linked to hemorrhoids. But what if the blood is darker, almost black, and mixed into your stool? That's a warning sign of internal bleeding higher up in the colon. Even more concerning is the blood you don't see. Many cases of colorectal cancer involve microscopic bleeding, which can only be detected through lab tests. A study published in the British Medical Journal found that patients with persistent hidden blood in their stool had up to a 30% increased risk of developing colorectal cancer. The mistake many people make is assuming the bleeding will stop on its own. But here's the truth: if blood in your stool appears repeatedly, no matter the color, it's time to get checked. Your colon may be sending an urgent message, and the sooner you listen, the better your chances of catching any potential issue before it becomes life-threatening. 5. Unexplained weight loss. Losing weight without trying might sound like a blessing, but when the scale keeps dropping without any change in diet or exercise, it's time to be concerned. Colon cancer can lead to weight loss in unexpected ways. A growing tumor may obstruct the digestive process, preventing proper absorption of nutrients, leaving the body undernourished even when you're eating normally. But that's not all. Cancer triggers an inflammatory response, releasing molecules that speed up metabolism and burn energy at an abnormal rate. This silent weight loss is often gradual, making it easy to ignore. According to the National Institutes of Health, unexplained weight loss of just 5% of your body weight in 6 months is a strong predictor of an underlying disease, and colon cancer is one of the biggest concerns. Too often, people assume stress or aging is the cause, delaying a doctor's visit. But if your clothes are getting looser, your appetite is changing, and you're feeling weaker, don't wait. Weight loss without explanation is never just random, it's a warning sign worth taking seriously. 6. Changes in bowel habits. Changes in your bowel movements might not seem like a big deal, but they can actually be one of the earliest red flags for colon cancer. The problem? This warning sign is easy to miss because digestive issues are so common. Most people chalk it up to stress, a new diet, or even recent travel. But when your usual routine shifts and stays that way for weeks, it may be your body trying to tell you something more serious is going on. As a tumor develops in the colon, it can gradually disrupt the normal flow and processing of waste, leading to unusual patterns like frequent diarrhea, ongoing constipation, or even a back-and-forth cycle between the two. Research has shown that people experiencing chronic changes in their bowel habits, especially those lasting longer than 4 weeks, are at a significantly higher risk for colorectal conditions. That's why paying close attention to your body is so important. If your bowel movements become irregular and there's no clear reason, no recent diet changes or lifestyle shifts, it shouldn't be ignored. Persistent diarrhea might be your colon's response to irritation from a tumor. On the other hand, constipation could point to a developing blockage. The bottom line is this: temporary changes are normal, but when they don't go away, they deserve medical attention. Duration matters. Don't brush off what could be your body's early call for help. 7. Narrow stools. Narrow stools, often described as pencil-thin or ribbon-like, can be a subtle yet crucial sign of a potential blockage in the colon. Unlike occasional variations in stool shape caused by dietary fiber intake, persistently thin stools may indicate that a tumor is partially obstructing the intestinal passage. As the tumor grows, it narrows the pathway for waste, forcing stool to take on an abnormal shape. Research published in the World Journal of Gastroenterology has highlighted that persistent changes in stool diameter, especially when accompanied by rectal bleeding or unexplained weight loss, can be an early red flag for colorectal cancer. Many people dismiss this symptom, assuming it's due to dehydration or minor digestive issues, but if the change is consistent over several weeks, it should not be ignored. A medical evaluation, including a colonoscopy, can help determine if there's an obstruction that requires further investigation. Early detection is key, and paying attention to these subtle changes could make all the difference in catching potential issues before they progress. 8. Fatigue and weakness. Here's a symptom that's incredibly easy to ignore: fatigue. After all, who doesn't feel tired now and then? It's one of the most common complaints people have in everyday life. But the kind of fatigue linked to colon cancer is not just ordinary tiredness. It's more intense, more persistent, and often has no clear explanation. We're talking about exhaustion that lingers, even after a full night's sleep. The kind where you wake up already drained or find yourself needing multiple rest breaks throughout the day just to function. You might think you're just overworked or not sleeping well, but this kind of deep, unrelenting fatigue often stems from something more dangerous. So what's happening in the body? In colon cancer, fatigue often develops because the cancer causes slow, internal bleeding in the digestive tract. This bleeding might not be visible in your stool, but over time, it leads to iron deficiency and anemia. And without enough iron, your red blood cells can't carry oxygen efficiently, leaving your muscles, brain, and organs constantly deprived of energy. It's not just physical tiredness either. People often report a mental fog, a heaviness in the limbs, and a lack of motivation that doesn't improve with rest. And the most concerning part? This may be one of the earliest symptoms, long before any abdominal pain or digestive issues appear. If you're experiencing fatigue that feels off, that doesn't improve with sleep, that's interfering with your routine, or that comes with other strange changes in your health, it's time to take it seriously. Your body could be whispering about something far more serious than just a busy week. And before we move on to the next sign, I want to take a moment to share an exclusive announcement with you. 9. Abdominal pain or cramping. We all get stomach aches from time to time. But persistent pain, especially if it's severe or accompanied by other symptoms on this list, could be a sign of colon cancer. The pain might be constant, or it might come and go. It could be sharp and intense, or more of a dull ache. At 35, Susan was a fit yoga instructor, the picture of health, when she began feeling fatigued and noticed mild abdominal pain. She shrugged it off, thinking it was just stress. But as the pain worsened and she experienced unexplained weight loss, Susan asked her doctor for a colonoscopy. Her doctor, convinced it was unnecessary for someone her age, dismissed her concerns. Even a specialist insisted it was likely IBS. After pushing for tests multiple times, Susan finally got her colonoscopy, only to discover a lemon-sized tumor in her colon. Worse, the cancer had already spread to her liver, stage 4. Devastated but determined, she became an ad urging others to trust their instincts and push for answers, no matter how healthy or young they seemed. 10. Unintended weight gain. Gaining weight without any clear reason can be frustrating, but when it comes with bloating, discomfort, or a feeling of fullness, it might be a sign of something more serious. While colon cancer is often associated with weight loss, some people, especially women, experience the opposite, unexplained weight gain, particularly around the midsection. This can be caused by a growing tumor that leads to fluid buildup, ascites, or inflammation in the abdominal area. As the tumor disrupts digestion and slows bowel movements, bloating can become persistent, making it feel like your stomach is expanding even when your eating habits haven't changed. A study published in the World Journal of Clinical Oncology found that some colorectal cancer patients initially presented with bloating, an unexplained abdominal weight gain rather than weight loss, leading to delays in diagnosis. The challenge is that many people dismiss these symptoms, assuming it's just aging, hormonal changes, or a sluggish metabolism. But if weight gain comes with prolonged bloating, changes in bowel habits, or discomfort that doesn't go away, it's worth paying attention. Sometimes, what looks like an innocent belly bulge is actually a warning sign that shouldn't be ignored. Regular screening can make all the difference. The American Cancer Society recommends starting at age 45 for those at average risk, but if you have a family history or other risk factors, you may need to start even earlier. Don't wait until symptoms appear, talk to your doctor and take charge of your health today. A colonoscopy isn't just a screening, it's a powerful tool for prevention. Yes, the prep may be inconvenient, but catching and removing polyps early can stop cancer before it starts. If you're over 45 or younger with risk factors and haven't been screened, now is the time. Your future self will thank you. If this video helped you, hit the like button and share it, it could save a life. For more essential health insights, subscribe to Healthy Care and turn on notifications. Stay proactive, stay informed, and let's build a healthier future together. See you in the next video.